Hello, Vincent Carroll speaking. This is tutorial number 44, prostate disease from an acupuncture perspective. Prostate disease is extremely common in men. It's an extremely common cancer as well. About 1 in 6 men develop prostate cancer in Ireland. It's the second commonest cause of cancer worldwide, and it's the commonest cause of cancer in males in Ireland. Prostate enlargement is something that occurs in many men as life goes on, and most men will have some degree of enlargement of the prostate. So therefore, what does acupuncture have to contribute? What does TCM have to say about it regarding theory? Well, of course, like most acupuncture-based perceptions of things, there is prostate disease due to deficiency and prostate disease due to excess. Very often as life rolls on for all of us, if we're not very careful, our kidney energies can decrease, can decline, and they have to be tonified, they have to be maintained. Particularly kidney essence can decline in older age, and because of that there's a tendency for a mild stagnation in the lower jaw that can cause mild prostate enlargement. And that's not uncommon, that's in fact very common. It's arguable that most men at some stage have mild enlargement of the prostate, and that can happen. It often doesn't produce many symptoms. Sometimes when symptoms do come about, there can be a frequency in passing water, there can be a hesitancy in starting the stream of urine, there can be a difficulty in knowing when the urine stream is completely finished, so there can be a dribbling effect at the end of the passage of urine, and very often there's no actual pain, but there's a lack of force with urine stream as well, and that's very common with mild enlargement to moderate enlargement of the prostate. I suppose very large enlargement of prostate can lead to urinary retention, and that could be a medical emergency, and that is not uncommon either in any casualty department. From an acupuncture point of view, there is a decline therefore in kidney essence and a sluggishness in the prostate, leading to a slight progressive but very slow enlargement of the prostate. Sometimes, of course, you can have excess, and when you have excess, you can have achieved stagnation in the lower jaw, leading to a blood stagnation in the lower jaw, leading to the production of what we would call blood mass. And blood mass very often corresponds to cancer from a Western medical point of view, but it can also correspond to benign enlargement as well. And sometimes the prostate can become very, very solid and very enlarged. Anatomically, there are 2 lobes to the prostate with a sulcus, meaning a sulcus, a line, a depression between the 2 lobes, and that can be felt on a rectal examination. But very often when you have a cancer, that sulcus is filled in with tissue that should not be there. In other words, cancerous tissue. So prostate cancer can often be diagnosed by a rectal examination. That seldom happens nowadays, mainly for medical, legal and other reasons of chaperoning, but it used to be an extremely effective way of diagnosing cancer of the prostate. An enlarged prostate will be felt as an enlarged prostate by a rectal examination, but the sulcus will be very well defined, so at least you know it's a benign as opposed to a malignant prostate. But from an acupuncture point of view, malignancy tends to be a chi and blood stagnation in the lower jaw focused in on the prostate. Now, why is it focused in on the prostate? There are many theories about that. None of them really are completely provable, but it is suspected where a person might have a chi and blood stagnation focused around a sexual frustration, then that might present as a lump or bump in the prostate, as opposed to chi and blood masses in other parts of the lower jaw, such as, for example, the rectum and the descending colon, which is an extremely common area of cancer as well in both male and female. But in men, where there is cancerous mass in the prostate, that's a blood and chi stagnation, and it can be progressive. It can metastasize into the bones, causing a lot of bone pain, and of course treatments required that will undermine yin by putting a lot of heat into the body. So from an acupuncture point of view, we have a lot to contribute. First of all, we can give advice as best as we can about how to perhaps avoid this by keeping a good, I suppose, focus on keeping our kidney essence up by balancing our life accordingly. Also, we can move our qi in the lower jiao as much as possible, either by acupuncture or simply by recognition of what's going on, and thereby adjusting lifestyle. The sense of entrapment in the lower jiao can be quite something that will, of course, trap the qi from moving, and then the blood won't move, then blood mass will form, and of course that is a carcinoma. The question is just where will it occur? And as I said, if there is a kind of a sexual frustration there, the likelihood is that it will occur in the prostate area. If a person is under treatment, of course, and their yin is undermined by chemotherapy, then there's a lot of things that we can do by promoting yin, by driving out heat, by dragging down rising heat, and all those various sort of techniques that we have to enhance yin and drive out heat. And that's simply secondary sort of acupuncture, or acupuncture that's secondary to chemotherapy. For the most part, regarding, I suppose, somebody that presents with an enlarged prostate, what do? Well, you move qi in the lower jiao, and of course we're talking about liver 3, gallbladder 34. Ren 3 can be a useful point as well to take excess out. We would try to drag down, maybe in all the yang channels, particularly urinary bladder channel, maybe urinary bladder 66, to pull down. If it actually has formed a cancer, one should move blood, and we're talking about spleen 10 bilaterally, and I would use electroacupuncture there in order to move blood, because we're talking about a blood mass. Take heat out as well. If there's heat there because the qi is very stagnant, generating heat, then and of course pain is heat as well very often. If it's a sharp type of pain, and one often gets that, then in that case it's a matter of taking heat out as well, because to do so pulls the rug from under the acceleration that maverick cells are under, and these are cancerous type cells. So that from a prostate point of view, when you decide whether it's from a Western medical point of view, of course you have to decide whether it is benign or whether it is malignant, and often there's a crossover there. From an acupuncture point of view, you have to decide whether it is deficient or whether it is excess, and of course if it is deficient, it's more likely to be non-malignant. In fact, it almost always will be non-malignant, and it just requires a gentle movement of qi and preservation of kidney essence and the enhancement of essence, and asking yourself, is the kidney going down the yin deficient route or the yang deficient route, and treating accordingly. If it's the yin deficient route, Ren 4, kidney 1 bilaterally. If it's the yang deficient route, well, I think Moxon, the Ming men, do 4, and the back shoe points of the kidney, urinary bladder 23, urinary bladder 52, right side and left side, would be very helpful there. But that's for deficiency. And for excess, ask yourself, is it blood mass due to qi invasion in the very lower jiao? And in that case, do everything you can to move it. Thank you.